Alright, we're going to do a quick video for the compressed head to toe. This would be like an assessment you would do at clinical. Just remember to always adapt your assessment for your patient. So if the patient had a stroke, you would probably go more into neuro. If they've had surgery, you would assess the incision and things like that. So this is just a general overview. Emily was kind enough to be my patient for today. Always you want to start with an introduction, wash your hands, and ask them their name and date of birth. So my name is Nicole. I'm going to be your nurse. I'm going to be doing a quick head-to-toe assessment on you. Could you give me your name and date of birth?
Emily Peters, 1983.
Okay. All right. Wash your hands. And you would always start with kind of like a general survey of the patient and with vital signs. For this purpose, for this video, I'm going to skip vital signs. There is another video that you can watch of me doing vital signs, but for that, we're going to skip for now. We're going to move on to neuro, and I've already asked her name and date of birth, so I don't need to repeat that, but you could ask other questions such as, what brings you in today?
I came to the clinic for a checkup.
Okay, and can you tell me who the president is?
Obama.
Okay, so that kind of just gives us a quick neuro. I'm going to check her pupils next. So you can use the little gauge here, and we got about a 4. And then if you can go ahead and just look at my nose, I'm going to check for your pupils to constrict. And with that, remember we're doing PERLA, so that'd be pupils equal round reactive to light and accommodation. So go ahead and just focus in on the pen and follow it in. And for that, we're looking for convergence and constriction. And you can always use your assessment guide, your sheet, to write on and to take notes. So I'm just going to go ahead and write down her pupil size so I don't forget. Do you have any history of lung disease?
No.
Do you have a cough?
No.
Are you a smoker?
Yes.
Okay, and how much do you smoke?
A pack a day.
Okay, and for how long?
10 years.
Okay, any shortness of breath?
No.
Alright. So next I'm going to go ahead and listen to lungs. Remember, when you listen to lungs, you always want to go on the skin. So we'll start with the front, and each time you feel the stethoscope touch your skin, if you could take a deep breath. And then also don't forget to get the sides. So we'll come over here to the sides. Alright. So next we're going to move on to heart and abdomen. If you can go ahead and lay down, I think that would work out easier.
Okay.
And do you have any history of cardiac disease?
No.
Do you have any chest pain?
No.
Notice any swelling?
No.
Okay. So first I'm going to check apical, so that's left mid-clavicular, 5th intercostal space. Listen to heart sounds. Okay. S1, S2 noted, no extra clicks, murmurs heard. Next we'd move on to abdomen, so you'll always want to start with inspection and go ahead and lift up their shirt, make sure everything's symmetrical, so note for any scars. And then for abdomen, we're going to listen. Next, starting in the right lower quadrant. She has active bowel sounds. Any troubles having a bowel movement or passing gas or anything like that? Any troubles voiding?
No.
Okay, and when was your last bowel movement?
Yesterday.
Yesterday? Perfect. So you can just go ahead and make note of that on your sheet. Then I'm going to move into peripheral vascular, so I'm going to check pulses, and we always do them bilaterally, so I'm going to check radial. And those are 2+, nice and strong. We're going to move to dorsalis pedis. Good, nice strong pulses. We're going to go ahead and check cap refill. Less than 2 seconds. Could we check clubbing? Put your fingernails. There you go. Perfect. And while you're doing that, you can kind of combine some of these. Since I was touching your hands, I could check her skin for moisture, if it's nice and dry, the temperature, she was nice and warm. You can also do skin turgor since you're kind of working right up here. Remember, we do skin turgor over the sternum or the clavicle, so you can check that. Also, you can make notes along the way. So I'm just going to start filling in. Skin color's appropriate. I don't see any edema. Emily, do you have any swelling or anything? Your hands look fine. Anything in the ankles? No troubles there?
No.
Do you have any troubles performing your ADLs?
No.
Meaning, no trouble cooking, cleaning, getting dressed, walking up the steps, anything like that?
No.
Alright. Alright, so musculoskeletal, we're going to do grips. And we do them bilaterally, nice strong grips. If you can put your arms up, we're going to do some push-pulls. So push against me, pull towards you. Same with the feet, we're going to do push-pulls. Push your toes down and pull your toes up to your nose. Finally, I just want to check overall range of motion and gait. So if you wouldn't mind, go ahead and sit up. And if you could just go ahead and walk maybe over there while I assess your gait. Evenly distributed weight, the arms are swinging, gait's normal. And finally, you would do a skin check on your patient. For this purposes, Emily, do you have any skin sores, breakdown, anything like that I should be aware of? But again, in the hospital facility, you would do the full skin check, and that's easier to do when they're in a gown. After that, you always want to make sure the patient knows the plan and that they're safe. So Emily, that completes the head to toe. I'm going to go let the physician know that you're ready. I'm going to do my documentation. Make sure that the bed's in the low position. Your call light's here. Is there anything I can get for you?
Nope.
Alright, wash your hands, and that completes our head to toe.